We have changed the way we treat the disease, and we have newer medications. And every time we get newer medications, they seem to be better, more tolerated, have more ranges that we can use throughout these years. And we look at the patient now when you come in, and we plan your treatment for the rest of your life. So it depends. If we have people coming in at 30 and 40, and we do have young onset Parkinson's, we're looking at treating this person now for 30 and 40 years. So we look at our medicines and plan how we approach this.
If you start off with a medicine, we lacked a chemical called dopamine, you said. Yes. So I take it the treatment is somehow to get the dopamine level to be increased. You either give it or you keep it from being disintegrated and it builds up.
Yes.
What do you do with dopamine? How do you regulate dopamine, or what do you do for the patient?
In any way possible. Our drugs do all the things you mentioned. One of the classes, an early class of treatment, is the MAO inhibitors.
MAO inhibitor.
Mm-hmm. So that's just an enzyme in the body, and what we're doing is inhibiting that enzyme from breaking down your dopamine. So therefore, your store of dopamine goes up.
And when the store goes up, do you see a regression of the symptoms if they didn't have enough dopamine?
Yes.
And then you build up the dopamine. Does the tremor go away? Does the shuffling gait go away sometimes?
Yes. Dopamine replacement helps your symptoms. Okay. Many times the gait, the stiffness, the walking, the tremor. It may not. The tremor depends. There's tremor predominant Parkinson's, and it can be very pronounced tremor. And if so, it will dampen it. May not take the tremor totally away, and will address the tremor in other ways. But it does help with their symptoms. And many times, the best we can hear from the patient is that my friends don't notice I have Parkinson's disease anymore.
If you put somebody on an MAO inhibitor and they do well, and 6 months later the tremor is getting a little bit worse, are there other medicines? Do you add medicines? Do you increase them? What's your approach? Well,
with the MAO inhibitors, we usually don't increase the meds much because they start out at one dose. It's one dose once a day, one pill type of thing. The other ones, two of them are once a day. One of them was twice a day, but just breakfast and lunch. So there's not a lot of changing the dose on the MAO inhibitors. And they will give you, some of them from 6 months up to 2 years now with our newer ones. So they could go 2 years at least on just that drug and be pretty well controlled.
And then what happens?
When they start breaking through or having recurrent symptoms of their Parkinson's, then we add another medication. So we leave these medications on, typically, and add on the dopamine agonist class. And this is drugs now that are designed to stimulate the same receptor in the brain that dopamine stimulates.